Hi, good morning.
Hey, how you doing, sir?
Miss Anton?
Yes, sir.
Hey, my name's Cameron. I'm the pharmacist. I just wanted to come in today and talk to you about your home medications. Is this a good time for you?
Okay, yeah.
Okay, perfect. So before we get started, I just want to make sure I have the right patient. What's your date of birth?
I'm 70 years old.
70 years old? Okay,
Yeah.
good. So we do have that. What about your address?
123 Main Street,
Okay.
Jacksonville.
Good. Okay, that does match up with what we have in our systems. So really, like I said, just wanted to come in and just go over your home medications. But before we do that, I wanted to see if you had any drug allergies.
I have an allergy to lisinopril.
Okay, and what happens whenever you take lisinopril?
My face gets all swollen and puffy, and my lips too. Sometimes it's hard to breathe.
Okay, face gets swollen and puffy,
Yeah.
lips breathe. I'm sure that must have been really scary whenever that happened to you.
Yeah, it was awful.
Okay, did you go to the hospital whenever that happened?
Yeah, I had to.
Okay, good. We'll go ahead and put this in your medical record as a severe drug allergy to the lisinopril then.
Yeah.
So as far as the medications you're taking, are you pretty familiar with them?
Mm-hmm.
Okay, so let's go ahead and get started. What medications do you take at home?
I take aspirin.
Okay, aspirin. And
Yeah.
then what strength of the aspirin do you take?
It's a baby aspirin.
Maybe at 81 milligrams?
Yeah,
Okay,
that
good.
sounds right.
Okay, so we have 81 milligrams of aspirin. How often do you take this medication?
I take it every day.
Take this
one
medication
time.
every single day?
Yeah.
Okay, and what are you taking this for?
For my heart, I had the heart attack
Had a heart attack? How long ago did you have your heart attack?
about 2 years.
Had a heart attack about 2 years ago?
Yeah.
And then, so as far as aspirin, do you ever miss any doses of this medication?
I try not to. I got a little pill box.
Okay, good. We have the pill box at home to help
Yeah.
keep us on track. So you just kind of load it up one day a week and then
Yeah.
go from there. Okay. All right. What else are you taking?
I take metoprolol.
Take your metoprolol.
Yeah.
Okay. And then now there's two types of metoprolol. We have a tartrate and a succinate. Do you know
Mhm.
which one you're taking?
I think it's the one with the T.
Okay, so you take metoprolol tartrate. What strength of that one do you take?
50 milligrams.
50 milligrams?
Yeah.
How many times a day?
2 times.
Take that one 2 times a day. Okay,
Mhm.
good. All right, and then what about any side effects from your metoprolol?
I don't really have any. Sometimes I feel kind of tired. But
Sometimes you feel tired. Okay.
Yeah.
Did that tiredness, has it stayed the same? Has it gotten better since you've been on metoprolol?
I think it got a little better as I used to, kind of.
Okay, gotcha. All right. And then what else are you taking?
I take hydralazine.
Hydralazine? And
Yeah.
then what strength of that one do you take?
I think it's 25 milligrams.
25 milligrams of hydralazine? Okay. And how many times a day do you take that one?
2 times.
2 times a day?
Yeah.
Okay. And then has anyone ever talked to you about taking hydralazine 3 times a day?
Oh yeah, I take that one 3 times a day.
Okay. So I know with especially medication you have to take 3 times a day. It can be really hard to remember to take in that third dose.
Yeah.
Do you ever find
I
you have
usually
difficulties
take it
remembering?
like with breakfast, lunch, and then dinner.
Okay, good. So it's always usually my recommendation with those 3 times a
Yeah,
day.
I
Take it with food.
keep my little pill box on the table.
Good. I'm glad you have that pill box as a trusty friend. They're
Yeah.
definitely very helpful.
Yeah.
Okay. So we have your aspirin, metoprolol, hydralazine. What else are you taking?
I take torvastatin.
Atorvastatin. Okay. And
Yeah.
then what strength of that one do you take?
20 milligrams.
20 milligrams of your atorvastatin.
Yeah.
Okay. And then how many times a day do you take that?
Just 1 time.
1 time a day. And then do you know what that medication's for?
I think it's for my cholesterol.
Cholesterol. Very good. And then, so as far as this cholesterol medication, have you ever had any side effects from it?
Not really, no.
Okay, good. All right. What else are you taking, Miss Anton?
I take the little nitro for when my chest hurts.
Okay.
Yeah.
So you just take that. Now, how are you taking that medication when you need it for chest pain?
I put it under my tongue and I take it, and then usually it gets better after the first one.
Okay.
But when I had my heart attack though, I had to take a second one, and then my bottle says that I have to call the 911 if it's not better.
Good. I'm glad you called 911
Yeah.
then. And then, so usually for that one, it says you take up to 3 doses in 15
Yeah.
minutes. Does that sound familiar?
It
Okay.
does,
Good.
yeah.
And then for that medication, how are you storing it at home? Do you put that one in your pill box as
No,
well?
I keep that one in the little bottle and I put it in my purse.
Good. Okay, that's awesome. I'm glad to see that you had good physicians and good pharmacists that really
Yeah,
talked to you about that
yeah.
medication. That's awesome. Okay. What else are you taking?
They gave me a new shot. Starts with an L.
Starts with an L.
Yeah, I think it's called
Lovenox?
Yeah,
Okay.
Lovenox.
Now, just when did they start this medication for you?
When I had my knee surgery, like a little over a week ago.
Okay, so they started this after you had your knee surgery. Was it, what
Yeah.
kind of a knee surgery was it?
They replaced my whole knee.
Knee replacement. Okay, good. So for the Lovenox injections, do you know what strength they gave you for the syringes?
I think they're 30 milligrams.
30 milligrams.
Yeah.
Okay. And how many times a day were you injecting that?
One time.
One time a day.
Mhm, Yeah.
Okay. I just want to make sure. Usually after the knee replacement, we do the Lovenox injections 2 times a day, about every 12 hours apart. But you were just injecting it 1 time a day.
Yeah, I'm
Okay.
pretty sure that's what it said on there.
Okay. Just wanted to make sure so we could put that in your medical record.
Okay.
All right. So we have the enoxaparin or Lovenox injections.
Mhm.
What other medications are you taking?
I'm not taking any other medications.
Not taking any other medications?
Nope.
Okay. All right, just kind of look through, in the past, it looks like you might have been on amlodipine before. Are you still taking that medication?
Yeah.
Okay.
Amlodipine.
So, okay, so you are taking amlodipine.
Yeah.
What strength of amlodipine are you taking?
10 milligrams.
How many times a day?
I'm taking it 1 time a day.
Okay. And then, so as far as the, kind of going back to the amlodipine and even your Lovenox, any side effects from either one of those 2 medications?
I mean, it hurts because I gotta give myself a shot in the stomach.
Okay, so there is some pain and discomfort there, but as far as like anything else, no bruising or bleeding, have you experienced any of those?
No.
Okay, so just a little bit of injection site pain. How long does that pain usually last for?
I don't know, maybe like 5 minutes.
Okay, so just 5 minutes after the injection and then
Yeah.
it tends to go away. Okay, usually with that medication, we do expect there to be some sort of, injection site pain or just a local reaction, but as long as it's going away, that is a good thing. So definitely the benefits of that medication, it's very, very important for it to be there.
Okay.
So it looks like we have all your prescription medications. Do you take anything over the counter? This is something you can go to a CVS or Walgreens. You don't need a prescription for it.
No.
Okay, so no over the counters. What about any herbal supplements or any other products like that?
No.
Okay, so no over the counters and no herbal products. All right, Ms. Antona, looks like we have all your medications up to date. I can go ahead and put this in your chart. Do you have any questions for me?
No, I don't think so. I just want to get better.
Okay, well, we're definitely, here we want to make sure we have all your home medications. We'll go and talk to the team, and we'll be back a little bit later to talk to you about what's going on, okay?
Okay.
All right, well,
All right,
again, my
thank
name's
you.
Cameron, and just let us know if you have any questions,
Thank
okay?
you, Cameron.
Thank you.
Bye.